Today we'll be discussing the importance of self-care, avoiding burnout, and compassion fatigue. First, we'll examine burnout. When providing direct care to individuals experiencing mental health or substance abuse disorders, it can be challenging to maintain a balanced life and a balanced perspective. The human service industry does not conform to the traditional norms of a consistent schedule or follow planned interventions. Because most services require the availability of support staff 24 hours a day, 7 days a week, it can be easy for a staff member to become overwhelmed by an increasing level of stress and responsibility. How do you know when you've moved beyond a stressful day to developing burnout or compassion fatigue? Well, keep in mind, becoming burnout does not simply involve having a bad day or a bad week. It does not simply entail being overloaded or trying to balance too many responsibilities. Being burnt out involves a chronic state of being out of sync in one or more areas of your life, which may result in deterioration of your physical and mental state. There are many factors that contribute to the development of burnout. However, in the human service industry, there are a few that manifest themselves consistently. For example, having a lack of control is one primary factor that may lead to burnout for direct care providers. Working in a field with high job demands and limited control is a combination that has been found to lead to increased coronary disease and depression. Working with individuals and families coping with mental health disorders requires a great deal of flexibility and good crisis management skills. Individuals in need of support typically do not have strong decision-making skills and have difficulty managing responsibilities. This combination will often result in decisions that lead to a crisis state or an urgent need for resources when their irresponsibility results in an impending crisis, such as unpaid utilities or rental payments. Insufficient rewards is another contributing factor that may lead to burnout for direct care providers. The direct care worker may feel they are taken for granted or not feel recognized for their support services, as well as undercompensated. This is a common experience in the human service field, since the individuals you are supporting are often unable to appreciate the care provided. This is also a common experience because the human service field often draws individuals that are focused on fixing the issues faced by the individuals they support, and may provide services that are outside the scope of their responsibility. While you may be focused on going above and beyond for your client, you may be jeopardizing your own health in the process. Your workload can also be a contributing factor in developing burnout. This often occurs when your workload is too complex or too urgent. For example, if you are in a position where you are working with high-risk individuals who are often in a state of crisis, this may keep you in a heightened state of awareness and an impending state of burnout. If you are in a position that requires you remain on call for multiple weeks with no breaks in between, this may contribute to the development of burnout. Burnout may also occur if you delay communicating with your supervisor when you are struggling with a problem or a challenging case and you are uncomfortable asking for help. Other factors that contribute to burnout often involve your work environment. For example, you may have a breakdown in communication with a colleague or supervisor with no mechanism for conflict resolution. This can often occur if the grievance procedures established by the company involve members who also serve in other administrative roles and direct supervisory roles. Other factors may include a work environment that feels unfair when there is a culture of favoritism, or if there's a conflict with your personal values. Combating a stressful work environment may require direct communication with your human resource department, particularly when there is conflict with a coworker. However, it may also require introspection and an assessment for some of the following questions. Is my employment enhancing my career goals? Do the duties and responsibilities align with my personality and my skill sets? Do I contribute to a positive work environment? Do I have realistic expectations of the outcomes for my duties and responsibilities? Am I looking for someone else to make me happy? Burnout typically develops over time and may be seen in stages. For example, The individual may have previously been enthusiastic about their work. However, they begin to feel a sense of stagnation. There's a reduced sense of accomplishment and typically a growing sense of frustration. There may be a mental exhaustion and a decreased interaction with others. Individuals at this point become disconnected and unfortunately develop a sense of apathy. Now let's review how to avoid compassion fatigue. While individuals providing direct care may be exposed to burnout, another potential challenge they may face is compassion fatigue, also referred to as vicarious trauma. Unlike burnout, compassion fatigue often sets in quickly as opposed to developing over time. Compassion fatigue is the emotional residue or strain of working with individuals that have been exposed to trauma. Compassion fatigue can occur after the exposure to one case or can develop as a result of cumulative levels of trauma. While providing direct care services, you may encounter individuals coping with sexual assault, domestic violence, child abuse, as well as physical violence in their neighborhoods. Individuals providing crisis response services are at high risk of developing compassion fatigue. This may involve a mobile crisis service, as well as individuals that are responsible for an after-hours crisis line. As a society, we may also be exposed to vicarious trauma when we have access to 24-hour news programs that provide graphic details of terrorist attacks, natural and man-made disasters, or brutal rapes and homicides. Signs and symptoms of compassion fatigue include emotional and physical exhaustion, withdrawing and isolating from others, high levels of stress, signs of irritability and anger, feelings of helplessness, as well as depression. Other symptoms may include an increase in anxiety and fear, feelings of confusion, changes in beliefs related to safety and trust, changes in beliefs related to power or control, changes in feelings of self-esteem or intimacy, as well as emotional numbness. Now that you understand burnout and compassion fatigue, let's examine some self-care techniques. If you feel that you are experiencing burnout or compassion fatigue, there are steps you can take to reduce the symptoms and avoid developing a potential mental health disorder. It is always helpful to seek the assistance of a licensed counselor. You should check with your employer to determine if they have a wellness program or additional assistance available. Oftentimes, agencies will refer you to a counselor in the community to maintain confidentiality and provide you with a neutral support system. In addition to potentially seeking the assistance of a counselor, there are additional self-care steps you can take to ensure you develop a healthy balance. For your physical health, you can eat regularly and choose healthy foods. Exercise consistently, but choose a method that you enjoy and will maintain. Get consistent medical checkups for prevention. However, if you are sick, take time off work to get well. Ensure you get sufficient sleep. The Mayo Clinic advises that healthy adults need 7 to 9 hours of sleep each night. You should also take vacations, which include day trips and mini vacations. You should regulate your time away from your telephone. For your psychological health, you can participate in personal psychotherapy. Take time for self-reflection, which may include journaling. Take time for personal growth, such as trying new things, engaging in activities in which you are not the expert, as well as reading literature that is not work-related. Be purposeful with paying attention to your inner experience, such as noticing your thoughts, judgments, beliefs, and feelings. Take time to receive assistance from others, and delegate when you can. Practice saying no to extra responsibilities. For your emotional health, you can make quality time for those whose company you enjoy. Maintain contact with those that are important to you. Engage in self-affirmations and praise, and love yourself. Participate in comforting activities, rereading your favorite books or watching your favorite movies. Make time to go to your favorite places and allow for feeling expressions such as laughing or crying. For your spiritual health, you can take time for spiritual reflection, meditation, and prayer. Engage in a spiritual community. Be open to inspiration and appreciate the non-material aspects of life. Maintain a sense of optimism and hope and identify the things that are meaningful and their place in your life. Contribute to causes in which you believe and those that will give you personal satisfaction. For your workplace or professional health, you can balance your workload or cases and allow for breaks during the workday. Provide quiet time and space to complete tasks and minimize interruptions and arrange your work area for comfort. Set limits and boundaries with clients and colleagues. Engage with coworkers and maintain regular supervision. And communicate when you need support or have concerns. Engage in projects or tasks that are exciting and rewarding. If you are in a supervisory role, provide avenues in which to demonstrate appreciation for your staff members. For your workplace or professional health, you may also want to evaluate your career path. If you're feeling burnt out in your current profession, you may want to complete a career inventory to ascertain whether or not you need to consider a career change. The U.S. Department of Labor has a variety of resources for career planning and career development. Their interest profiler may be found at mynextmove.org, and additional resources on the outlook for your profession